Hey, Ancil Lea here today with my good friend Colby Wilson. Hey, Colby, good
Hey,
morning.
hey, good morning. Good morning.
Hey, Colby is the CEO of Martin Orthopedics in Little Rock, Arkansas. And hey, we're just talking with Colby today and to get an update from him on what they're doing with patients and COVID and surgery and COVID. And kind of give us if you would, give us an update on really, listen, I know you guys do go to have painstaking precautions
Mm.
you have in place and procedures to protect your patients. Tell us about those coming into your clinic.
Yeah, I think initially when COVID, kind of hit, really, that there was a lot of uncertainty of how, clinics should handle patients coming in and how do you keep them safe. And through all this whole process, and you got the governor's office, you know, rolling out the kind of phased reopenings and those types of things. And I think at the point where we're at, we feel like we've at least fine-tuned some of our processes to make it as to mitigate as many exposures as we can, right? At this point, our lobby is mostly open. We're practicing the 6 foot kind of social distancing when patients come
Right.
in. We're still doing temperature scans here, but now instead of an employee holding up a temperature scan, we have it mounted to a wall, so the patient can walk up and just scan themselves, and the staff can see the temperature there.
Really?
Um,
That's
yeah,
cool.
it's pretty, just it's another way to kind of lessen another touch point, right?
Right.
Um, and something, most places probably do. Our employees do wear masks here, but we wanted to go an extra step just to make sure not only we're protecting our employees but the patients is even not even when patients aren't here, we're asking our employees to wear their masks. So if someone were to come into my office for a meeting, we would both have our mask on.
Right.
We just want to make sure that we're doing everything we can to mitigate those types of things, to the point of we're even trying to stagger the lunches for the employees here. So anything we can do to help there. I mean, we got plexiglass set up at all the workstations where you check in and check out. Um, the lobby should be spaced out enough where we can have the patients 6 feet apart. And
Right.
if we ever get to where it's maximum occupancy, we'll kind of do some things we did in the past. We'll have some patients wait in the car,
Right.
and we'll give them a call when we're ready.
Yep.
Um, so really, we're just doing kind of everything we can there to help make sure that there's not, you know, uh, a bunch of people congregating together in any small confined spaces.
Well, and that's important to know as a patient, to know that you guys are taking those precautions, so they feel safe,
Yeah,
and they
right.
feel safe in coming in. And one of the other things we've talked about is them actually going and having surgery, and the precautions that are being taken there as well. Can you speak
Mhm.
to that a little bit?
Yeah, so we do the majority of our procedures at the Arkansas Surgical Hospital. We do some at Little Rock Surgery Center as well, um, and then a few at the Baptist in North Little Rock. But again,
Right.
the bulk is at Ash, and for there, they're still doing the pre-screening for COVID, before their procedure. So we're getting those results back before they even have their procedure. So it's just an extra precaution that can help the patient, help the staff, and we just want the best outcome there. And hopefully that provides a little more kind of security on their end, knowing that that screening is being done not for them, but for every patient that's having a procedure.
Hey, so here's a question for you. So, a patient goes in to have a procedure. Do the loved ones get to come with them into Ash or wherever they are?
Yeah, the waiting rooms, I'm sure they're allowing them in there, and it's I know Ash has done a really good job of also screening all visitors, guests,
Right.
vendors into their hospital. They're doing the temperature scan and asking them all the very probably typical questions everyone's used to being asked about COVID now. Have you been exposed to anyone with symptoms? So everyone that's entering in the facility is also getting asked those questions.
Yes, and I will attest to that. That I went to Ash yesterday, and I feel like they drew blood for me to have
Oh,
to
sure.
use the conference room. So, um,
Right.
yeah, so they are so they take great, and that's what I really want to get across, that you guys are taking great pains to take these precautions to ensure your patients' safety and
Hmm.
health, and that they can feel good about coming to see you and getting treated.
Yeah, and so that's a good point, and we want to make sure we walk the fine line of being able to provide a service to the patients, and being open for that, but also making sure we're protecting the patients and our staff, and being cautious there. So we don't kind of overcrowd ourselves. Um, but at this point, like I just want to make sure that if someone's looking for an orthopedic provider, like we're accepting walk-ins right now, even though it's in the middle of a COVID, but we'll still do the screening. We'll still make sure everything's okay there, but we want people to know like we're open, and we'll accept walk-ins. Like there's no appointment necessary to even do that.
Right. Well, awesome. Listen, thanks for taking a couple minutes with me today. Anything else you'd like to say, that or a message you'd like to get across to folks, patients, employees, folks
Yeah.
considering treatment?
So a lot of good stuff happening here. We just recently signed two new physicians, Dr. Wilson and Dr. Goodson. One specializes in hips, and the other one specializes in feet and ankle. And they'll do general orthopedics as well. But we're excited to bring them on because it kind of gives us a full kind of comprehensive care. We got shoulders and upper extremities, we got knees. Now we got the hips and the feet and ankle, and they'll do general orthopedic stuff as well. But we like the fact that they're all fellowship trained and
Right.
kind of experts in those areas. And not only to bring them on, but in the past month we opened up two offices. We got one now in Russellville
Right.
and another one in Hot Springs Village to join our already established North Little Rock and Little Rock offices. So we're excited about that, and we think it'll be really good for the River Valley
Yeah.
community and the Hot Springs and Hot Springs Village community. So we're excited that we can actually provide services to those areas where they don't have to, commute here to Little Rock. So a lot of good things going here, and that we want to be able to serve our patients better.
Well, fantastic. Well, excited for you. Hey, thanks for jumping on here to share this information with patients. I think they really, and that's really my desire, is that the patients understand it's safe to go in
Yeah,
and get treatment. And hey, I appreciate you so much, Colby. And hey, see you soon. And hey, if you have any questions for Colby, hey, I'll put his website down here at the bottom, at the end here, and or you can direct message me and I can get a message to Colby if you'd like. Anyway, thanks for joining us today. Thanks, Colby.
yeah. Thank you, Ansel. Good to see you.
Good to see you.